Welcome to Offline Utmostt Review, where we share informative, educative, and inspirational stories. Today we have Dr. Kola Okunade on the show. He's a psychiatrist and a drug addiction expert. I'll leave you to introduce yourself. I haven't said anything that the audience needs to know about.
Okay, good evening, everybody. People in the medical profession know me as Dr. Kola Okunade. Friends know me as David Adekola Prescott. The same person. I work here in Nigeria, situated in Ibadan. My facility is situated in Ibadan. And I'm very passionate about the mental health of everyone, male, female, young, and old. And when I was in medical school, I never thought I would find myself in mental health. I wanted to be a surgeon. You know, those guys are cut and sew. You know, that was my passion. But as time went by, I developed a desire for mental health of people. I kind of have this compassion towards those who had behavioral problems, emotional problems, and there was very little help for them. And somewhere along the line, as God will have it, I started reacting to blood. And I had no choice but to now.
Oh, fantastic. Okay. Thanks for the short introduction. So, I mean, today, there's a lot of issues around mental health and drug addiction, especially in Nigeria. Could you sort of talk us through the issues with today's youth? Because, you know, there's a lot of things happening in Nigeria. Nigeria has a population of about 200 million, if not more. But we find that we keep hearing stories that there's enough issues with mental health and drug addiction.
Yeah, Sheikh, that's very correct. We have about 200 million people in Nigeria. And funny enough, Nigeria has about ×3 drug use prevalence compared to other parts of the world. And it seems to be increasing every day. Some of the theories behind the widespread use of drugs by the young people here in Nigeria seems to stem from the fact that, you know, one of the things that keeps us going in life is hope. When we know that there's a future for us, I can get a job when I finish school, I can make some money to keep myself and my family going. But that seems to be a mirage now in Nigeria. And kids are turning towards the fringe cultures like drug use, prostitution, and internet fraud. Now, all of this has a play on the mental health of young people. For instance, those who are heavily involved in internet fraud, the so-called Yahoo boys, will find out that there's a high prevalence of drug use amongst them as well. We have things like opiates, the common one is tramadol, and we also have things like the use of benzodiazepines, rohypnol, amongst that particular population. Cannabis used to be a big deal back in the day, but now it's not such a big deal anymore, even though it's still the most used drug in Nigeria after alcohol. You know, and then we have these new synthetics coming up and new formulations, you know, because in my practice, somebody says he takes drugs like Arizona, which is something that is smoked. And when you do a urine toxicology on the person, you find that there's a little bit of crack cocaine, a little bit of opiates, and other drugs. I may not even see cannabis in that urine test, which means whatever they're taking right now is really not cannabis. And that has led to an increase in mental health needs of these people because a whole lot of them are coming down with psychotic illnesses, with depressive illnesses, anxiety disorders, and a mix of all of these other illnesses as well. When we look at mental health in Nigeria as a whole, we found that there's a paucity. There is not enough being done. And Nigeria is a country that is driven, most of our institutions are driven by the government. So the government has to take the lead in mental health care. As of today, as I'm speaking with you, we don't have a Mental Health Act in Nigeria, which guides the practice of mental health care in Nigeria. Yeah, we don't. What we're using is the Lunacy Act of 1958. The one the colonial government had in place. The Lunacy Act, that's what it's called.
Oh,
and which is which was given to us in 1958. That was before we attained independence. And that has not been reviewed up till date. No, the National Assembly has refused to pass the Mental Health Act bill after so many presentations, for whatever reasons best known to them. So now we don't have a proper legislation to establish mental health care as a holistic and modern practice. The field is wide open to all kinds of people, you know, and then most of mental health care is also being done by the government. We have the standalone institutions like Neuropsychiatric Hospital Yaba, you know, the Federal Neuropsychiatric Hospital Abeokuta and such places, and then we have the mental psychiatry units within general hospitals, like the University College Hospital that has a department of psychiatry. You know, so we need more people to go into mental health care. We need more professionals, not just psychiatrists. We need psychiatric nurses. We need mental health social workers. We need psychologists. We need even mental health technicians and extension workers to come into mental health, because the need is great, but there are too few people. There are too few people in the field working as mental health professionals, you know, and that starts with, for us to have that, we need to have proper legislation in place. Now, coming down to the drug use, you know, was known as a transit. We're labeled as a transit country. That means drugs coming from Asia go through Nigeria to Europe or the Americas. But today, we have become a drug-using country. We have an agency in place, that's Nigerian Drug Law Enforcement Agency, that started out as an enforcement agency, but now they are becoming, the NDLEA, which are as an enforcement. We used to call them catch 'em. All they used to do back then was go raid drug dens where people use drugs and arrest users as well as those who are selling it. But today, that is changing. They are beginning to see that drug users are not to be criminalized. They're not to be stigmatized, you know. And now the emphasis now is on stopping the sales of drugs whilst helping those who are using drugs to get help. So the NDLEA units in different states now have a counseling section, you know, counseling section apart from the enforcement section. So the focus now is more on drug demand reduction. Besides that, we also have foreign agencies assisting us, like the United States Department of Health. We have the Colombo Plan, you know, and they're heavily involved in training substance use professionals. People will be involved in treatment of those who have substance use problems. People will be involved in prevention campaigns for substance use. So especially the Colombo Plan, U.S. Department of State programs, signing up for them and getting trained as substance use treatment and prevention professionals. So all of this is going on presently. But until there's a legislative backing, we're still going to be, you know, twiddling our toes.
So from your short explanation, there's a couple of issues regarding these problems. But I can understand there's a medical issue and there's a political issue in terms of passing legislation.
That's right.
Because it's as if the governments are not even at the forefront of pushing the agenda. Maybe they don't even understand it. Because I was in Lagos in December.
That's right.
I could see a whole lot of things in traffic. If you're driving, you can just see people feeling, you can tell they're high on some sort of drugs, feeling drowsy. And it's as if because the social economic neglect is paramount in Nigeria now, a lot of you just go towards drugs.
That's right.
I remember back in the day. Can you hear me?
Say that again, please.
Hello?
The line broke.
Yeah, I said I remember back in the day when people. Yeah, I can hear you. Yes.
Okay.
Yeah. When people have mental health issues or things of such nature, they used to take them to churches or mosques to cure them.
That's right.
And I still believe, that may still be happening up until today. But I would like to believe now that, especially during this time of COVID-19, I think there's been a lot of things COVID has brought out. So I'm thinking maybe the government, is there any way there can be an agenda to push it forward? What needs to be done on the political side? Because until the political side is done, the medical situation will be dragging as well. What can be done to push the agenda to the politicians or to the House so that they can know what needs to be done? Because a lot of these people, they go abroad. Some of the politicians have children that have these issues, and they get them treatment abroad. So why is it not that? Why are they not taking this as important as it should be?
Yes, it's not just the political class that's even though the boxers at their table that are culpable in this matter. We have some associations in Nigeria, like the Nigerian Medical Association. We have the Association of Psychiatrists in Nigeria. We have various medical professions. We have the Nigerian Nurses Association as well. These are all the people that need to push the agenda. Now, you mentioned COVID-19 pandemic. Yeah, ever since this COVID-19 pandemic started, there has been a little upsurge in those who are demanding for mental health care. People come down with depression, people come down with anxiety disorders, people that had other avenues for venting their frustrations were now stuck at home because of the lockdown. Were now stuck at home with their family members, and that kind of just heightened all the problems they had before. Now, for the political class to actually understand that mental health should be a priority, should be on the front burner, it will need a whole lot of push, both from within and from outside of Nigeria. The problem with mental health is that it has always been sidelined by the political class. It has always been sidelined, and that's why till today we don't have a legislative backing for mental health care in Nigeria, a modern legislative backing for mental health in Nigeria. This same political class, when they have needs, mental health care needs, they actually have people who attend to their needs within Nigeria. Very few of them take their family members abroad, and it's so disheartening that even though they come into a place like maybe Yaba and they see the challenges being faced by the institution, but they don't go back to do something about it at the house. It's like something that exists, but we pretend does not exist. I've had patients who are whose family members or parents are from the political class, and I'd always hoped that, because I'm always advocating, I'd hope that with them getting into positions of influence, they would do something about it. But year in, year out, it's just the same old story. Nothing ever happens. Now, for you to fix mental health care, other institutions need to be involved. You must fix education. You must fix infrastructure. You must fix housing. You must fix security. You see, because when somebody is poorly educated, the person will not likely amount to much. And then we have a lot of unemployed people all over the place who pass time by taking drugs. And these drugs, some of them will eventually develop other mental health issues. Some of them will go drug dependence, and then we now have the social problems that will come out of that, because these drugs are not, until they're not employed, they're not earning income, they have to find ways of getting to buy the drugs. So to be able to fund their drug use habits. Now, so if you look at it in that light, housing needs to be fixed, education needs to be fixed, industrial development needs to be, jobs must be available, and skilled. People must have the skills to be able to access these jobs. So we cannot look at drug use or mental health as in isolation. We must look at it, broadly, and look at all the other things that impinge on mental health. COVID-19 came, and we found out that we're not prepared. Even as a country, our institutions were not prepared to manage COVID-19. And even as I speak with you, because I also represent the Oyo State Medical and Dental Association, I represent them as a COVID-19 program committee chairman. So when we look at our medical institutions, we find that a lot of anxiety are seen in the workers because of COVID-19, because they can see that they're not being adequately provided with protective equipment, and they don't seem to have a say in what happens within their hospitals. So all of this is adding up, and COVID-19 just revealing all the shortcomings that we have been pretending was not there, that is there in our healthcare system. And like I said, since mental health is something that people look, they sideline. So when it comes to even the response of the healthcare system, to COVID-19, mental health is not even looked at. It's only of recent that the WHO and NCDC, that's Nigerian Center for Disease Control, are started talking about mental health aspect of COVID-19 pandemic. The people, those who suffer from, who get infected with the virus, and those who have to care for them, they need mental health support. I know that Lagos State has, part of Lagos State's COVID-19 response is also the psychological support. I'm not sure about how much of that we have in other states, but I know that Lagos State has a very robust psychological support for either the victims of COVID-19 or their relations or even their carers, So okay. The mental health needs to be brought to the forefront, because everybody that has a brain can have a mental health problem, but not everybody can have an obstetric problem, because you have to have a womb that will get pregnant before you can have an obstetric problem. Not everybody will have an orthopedic problem, but everybody can have a mental health problem.
I mean, here in the UK, mental health is a big, there's big awareness for mental health. Every time, every year, the set dates where, the government comes and supports, celebrities come and support. I think it's the awareness that is not enough. And I think as Africans and Nigerians, sometimes we're in denial. And it's a big issue where, and you rightly said, the socioeconomic neglect sort of covers, all these aspects of what needs to be done and what is not being done right now. So going forward, what does your clinic, your practice, what sort of services do you provide regarding this? And what has been some of your experiences in terms of clients that you've dealt with in Ibadan there?
Okay. Yeah, my clinic here, there's the Sanctuary Drug Education and Rehabilitation Center, which has been in operation for about half a decade. We've had patients come from all over the world, actually. I've had two clients from the United States of America. I've had one or two also from the UK, but most of them are from Nigeria, usually Lagos, Abuja, and one or two from Port Harcourt. I've had a handful from Ibadan. Now, the major challenge with accessing drug treatment in Nigeria is the cost. Where you have appropriate, adequate treatment, the cost, of course, is prohibitive to a whole lot of people. So that's a major challenge. That's why the government needs to step up their game, into the funding of drug use treatment. Another challenge that we have faced is in getting people who are in paid employment to come in for treatment. Now, the minimum duration of treatment is about 90 days, which is 3 months. Most employers are not ready to give a leave or a vacation to their staff to access drug use treatment. In fact, some of them will actually sack anyone that is found to be a drug-dependent individual Ditto the military. Although I heard that is changing within the military now, that some of my colleagues are now working with the military to ensure that military personnel get the care that they deserve when they become victims of substance use. On a family by family note, trying to get the family to understand what needs to be done after discharge has been a major challenge for us here, because people feel that, the person has been with you for about 3 to 6 months. When he comes out, the person should not go back to using substances or drugs. And all the education we give them seems to be water on the duck's back. We know that somebody that is drug dependent will forever be in recovery. The tendency to have a relapse is as high as the tendency to have a relapse from a hypertension or a diabetic situation. It's about 60% relapse rate, because we need to follow them up. We need to follow them up closely, first for the first 2 years, and then for the rest of their lives. It's a chronic relapsing brain disease. Addiction is a chronic, which means it is not curable, but it can be managed. It's a chronic and is relapsing, which means it will happen again and again. And that's why a lot of mental health practitioners don't like to go into substance use treatment, because they say, you are not going to get much out of it. They keep relapsing. Yeah, they keep relapsing, but not all of them will relapse. And it's a brain disease because it affects the functioning of the brain. It affects the performance of the brain in certain areas. It short circuits certain areas of the brain. So even though the person wants to stop, he finds himself going back all the time. And then some who want care, who can afford to receive care, they are afraid of the withdrawal symptoms they may have when they stop taking the drugs. So unless something happens to them, like maybe they have a road traffic accident which brings them into the hospital, a whole lot of them don't want to even come in for treatment, and then there's a stigma attached to it. For instance, my facility, we don't have a signage because people don't want to be associated with us on our street.
So what's the signage? What does the signage mean?
I mean, a signboard, something to
signboard.
Tell people who we are. Signboard.
Where you
we
are.
Don't have any because because of stigma. When clients want to come or their family members, they don't. Some of them do, even without the signboard, they still don't park on our street. They go park about 2 streets away and walk down, but they don't want anybody to see their car parked in front of our facility. So stigma is also a big issue. It's also a big issue with people who want to receive care. So the major challenges are the cost of treatment and stigma, and the fact that the government is not providing any support in any way. Stigma is a big issue. Another thing is all the various health insurance schemes that are available in Nigeria. There's none that caters for those with substance use treatment presently. Wow. And that's why legislation is important. That government involvement has to be felt, especially in addiction, in addiction treatment. The government has to do a whole lot more than they're doing. For it's only of recent that the Nigerian health insurance scheme started accommodating mental health. It's only of recent that started accommodating mental health. And even without one, there's a restriction on the number of weeks you can admit somebody for mental health care. I think it's about 2 weeks, after which the person must start paying for the treatment. And anybody that has ever worked in mental health knows that mental health care, especially when it involves residential care, is not 2 weeks. Sometimes it can extend for months, And if it's out-of-pocket payment, are they going to be able to afford that? So these are some of the factors that are affecting mental health as a whole, and then affecting substance use treatment as an entity.
Okay. So, for instance, do you think that if there's, I'm not sure if there's some sort of organization in Oyo State, are you able to sort of push something from Oyo State, for instance? Because I hear that the present governor that is there right now is open to different ideas and to solve people's issues. This is what I hear. I'm not sure of that. So I'm thinking, what if like a movement is start from a state level, and then gradually can go into the other parts of Nigeria that way, and Lagos and things like that, because this is a big issue right now.
There's a colleague here, Dr. Abdul Malik, who has an NGO, a non-governmental organization called Asido Foundation. He's heavily
Okay.
involved in advocacy, involved in awareness campaigns, And you are right about the governor of this state being a listening governor. However, he has so much on his table right now. You see, I'm not saying that's a slight, but the way our leaders come up, our political leaders come up, is not actually based on performance. It's if you have enough money, if you know enough people, you become a leader. So now that COVID-19 came in the first year of his tenure, he has that to battle. He has that to battle, and that has revealed all the deficiencies in various systems, that the shortcomings, even the healthcare, in other things, So he has a lot on his plate right now, so pushing forward mental health, even though it's something we are doing and we keep doing it, it seems that we're not receiving the kind of attention that we require. Mental healthcare. Healthcare in Oyo State is not receiving enough attention from the government. I will tell you this: as much as the government is doing, there are some other things that they need to do for us to be able to have enough healthcare workers. Doctors come into the state civil service and they leave after a few months because of poor remuneration. Wages are not at par with other states. So when they get an opening in other states, they migrate. I think we have about 70 doctors servicing the whole of Oyo State of 33 local governments.
Wow.
So most of them are most of the doctors are in Ibadan. So we even have some hospitals that don't have a doctor present in Oyo State. So we're hoping that the governor will and the Oyo State Doctors Association have been in dialogue with him for the last few months over at least take care of the wages, and then take care of the hospitals as well, so that we can have enough doctors coming into the system. And as they come in, of course, mental health care will also benefit from it. We also benefit from it. So but if you're not employing and they're not staying, like mental health will always suffer, because it's a cousin that nobody ever remembers.
Yeah, I see that you do seminars from time to time. What are these seminars? What are they based on? What do you do there? And is it just something you do all over Nigeria, or just within your state?
No, the seminars and the awareness programs are usually done based on invitation, and then some of the organizations I belong to, like the Christian motorcycle club that I belong to, sometimes we hold seminars where we talk about mental health, talk about different aspects of care for people and all of that, and then some of them are organized by other institutions, maybe schools, churches, where I go to speak about mental health. And of course, whenever I'm speaking about mental health, I have to talk about the drug use aspect of mental health as well. Yeah, so oftentimes by invitation that I attend these seminars as a facilitator, or I go in there as an expert to talk about mental health generally. I wish the mass media, as the radio stations, could actually invite more mental health care personnel to talk about mental health on radio, because radio has a wide reach of and it cuts across the social strata of any community. So okay. I wish strongly that as part of their corporate social responsibility, the radio stations will give about 1 hour a week to mental health.
Okay.
And I know,
okay.
that you.
So I mean, a couple of days. Yeah.
Yeah, I know that you have contacts in the electronic media here in Nigeria. So maybe you could become an advocate for mental health as well. And all we're asking for is 1 hour a week for someone to come in, to come in and talk about mental health. And that would go a long way to helping improve mental health care in Nigeria.
Okay. What we'll do is we'll try and I'll try and speak to some people in Lagos and Ibadan. Some media people, maybe they can grant you interviews, and like if there's an awareness that can be created, they can come in and sort of, cover it. A couple of days ago, a friend of mine saw the advert that about this program that we're going to do, and was actually telling me that, wow, I didn't know that, you knew somebody that was an expert in this. I think there was a time somebody came from America, because mental health and drug abuse is not only common in Nigeria, it's common everywhere in the world. So people, like you rightly said, sometimes some parents send their kids abroad to go and study, and some, they join bad groups and they find themselves taking drugs and having a lot of issues, and they have to come back to Nigeria. So there's an increase in that as well. That people come from abroad, they want their kids to come and stay in Nigeria, and they're looking for clinics such as yours. So I think maybe if we do more awareness like this, a lot of people will know that the services are available in Nigeria. So do you provide training, like certifications? If people want to, because people like yourself, the industry.
We like I've done the training. I've given basic training to those who become substance use treatment providers.
Okay.
And I've done a couple of that last year. In a bid to increase the number of people that have some scientific knowledge about substance use treatment, so that people will not be going to churches and all these other non-professional places for treatment. Another reason behind training those people was also to disabuse the mind of people about substance use and substance users and substance use treatment. So I do that, but and then I give them some form of a participation certificate that they participated in this, and I encourage them to go and take the Colombo Plan, United States Government of Health program, which affords them an international certification, which is recognized all over the world. So I encourage them. So at every training session in the last 6 months, in the last 8 months before the COVID pandemic started, you will always see about 2 or 3 of those who are given basic addiction treatment training here. You always see them at those other trainings, getting ready for the certification, international certification. We don't have any local certification yet, any Nigerian-based certification for substance use treatment and prevention professionals. So we still have to do the international one. Hopefully, in another couple of years, we may have that, because there is a Nigerian Society for Substance Use Professionals, which is affiliated to the International Society of Substance Use Professionals, ISOP. So I'm sure over time we'll start a local certification for substance use professionals in Nigeria.
Okay. Are you open to partnerships with academic award bodies in the UK that can offer this kind of training? Another partnership in terms of...
Oh, yes, I am.
Okay.
Oh, yes, I am. Every little helps. Whoever wants to help, I will gladly partner with such a person, especially in the area of training, in the area of training and certification of substance use professionals. Because if you have about, on the average of about 15 million people who have been drug exposed, you really want to get people out there to help them, come out of these problems. So yeah, I'm fully open to partner with the first female Nigerian psychoanalyst, classical psychoanalyst, and she was thinking of setting up something here in Nigeria for training people in the area of psychotherapy, because that's also greatly needed in managing people that have mental health issues and substance use problems. So that one is also on the burner.
Okay, because this is what I'm thinking. If you're able to push the agenda forward by training a lot of people, if there's a market for it, even if there's no market for it, when people get trained and you have a lot of individuals that have these certifications, that understand what mental health means, how to deal with it, because there are different levels. There's like level 1, level 2, level 3, just basic certification that you can work on, and they can keep, sort of getting more knowledge. I think if there's a lot of, say
That's
for
right.
instance, you're able to train about 100 or 150 people in Ibadan alone, that might actually
Wow.
bring, that is possible. Because if you,
Yeah, I mean,
there's, yeah,
when I said wow, I was just actually sorry. I was thinking of, when I said wow, what I meant by wow was that what's so much good will come into Ibadan.
yeah,
So much good in terms of now we have people who can address mental health care needs or in
yes,
their various communities. You know, they don't have to come to the big hospitals. They don't have to come to the private hospitals. They can actually access care within
yes.
their own communities. That would be fantastic.
You know, I think what can the way these are just recommendations from me, and we can definitely. I know I'm able to do a couple of things on that in terms of the training. So if we're able to attract people in Ibadan, if we have like 150 to 200 people, and they get trained and they have certifications and they get
That's right.
certifications from here, for
That's right.
instance, um,
That's right.
then they can show their certificates. They can have like some sort of CV and training, and
That's
then
right.
because there's so
That's
many
right.
hospitals, private hospitals, and even other public ones as well. So maybe this can sort of
That's right.
galvanize a movement for the awareness. Because the more
That's
people,
right.
there's so many ways this can happen. Everybody's on social media these days. So if people know that, if they get that training, if they invest, an amount of money into it, after they get the certifications, they can get jobs. Because mental health and drug abuse is a big issue in Nigeria, especially. And so that's just my own way of maybe one or two solutions can come about. But I think if the awareness is there and people are trained and they know that, okay, this is
That's right.
mental health, because in Africa and in Nigeria, when people start having mental health issues, next thing is that people think there's some witch in the village that's doing it. They start going
Yeah.
to pastors, they start
That's
going
right.
to
That's right.
mosques to
That's
go
right.
and pray. Sometimes they're just basic things that we need
That's
to
right.
understand, but because the awareness is not there, people are looking for what's not lost. During this COVID-19 period now, there's a couple of memes I've seen online that people have said, you know what? People have said things like the witches and wizards that chase people around, they've been indoors. The pastors haven't been in. But once they start going back to the pastors, they evoke them. And which, when you look at it, it's funny, but it's true.
Yeah. Yes. Yes.
It's
Yes.
just a
Yes.
mindset of people. So I think if people are
That's right.
trained, and it's a good thing that, with what you're doing. So the training is there, and people know that, okay, they can get trained. And even if they understand that there's 60 to 70% of them getting employment after doing the training, that's huge.
Yes. 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 In fact, one of the guys we trained last year, he
Yeah.
has started an outpatient treatment facility where those who have drug problems can actually come and get some form of counseling. Some form of counseling. He's also a student of the University of Ibadan, mastering in clinical psychology. So the exposure he got at our training kind of pushed him to say, okay, you know what? Let me do the little I can do. Because there's something we say that a little counseling can go a long way. It's better for someone to have some counseling to have no counseling or no care at all. So, so that's one of the good things that's come out of that. He has created a job for himself and is able to help to meet the needs of people within his own community. So yeah, so you're quite right. It will really do a whole lot. It will really do a whole lot in stemming the incidences of mental health problems and helping people to access care.
Okay. Fantastic. Dr. Kola Okunade, thank you for coming on Offline Utmostt Review. You've shared a lot of expertise and experience with us. Thank you very much. Keep pushing the agenda forward, and hopefully people will understand what is called mental health. Because as long as we all have brains, at some point people have mental health issues. It's something that can come due to stress and other factors as well. So thank you very much. We look forward to having you once again at some other time. So hopefully the next time we'll be talking about the progress we've made in terms of training. So thank you very much.
All right.
Have a lovely day. Stay blessed.
Thank you. Thank you. Utmostt. I really appreciate it. Thank you so much. God bless.
Thank you. Bye-bye, sir. Bye.